Hi, my name is Wesley Shook. I'm a nurse practitioner here at Limitless Male Medical Clinic in Papillion, Nebraska. Today we're going to be focusing on testosterone therapy. First off, what is testosterone? Testosterone is the male primary sex hormone. It's responsible for providing males with their secondary sex characteristics. This includes gonadal development, muscle tone, and increased hair development in males. So the brain is responsible for eliciting the hormone response and to properly communicate for the rest of the body. These are chemical messaging signals that our cells use, so that way the brain can communicate what it wants to elicit the body to do or the actions it wants it to perform. And there's also a negative feedback that happens, that the body receives these signals and transmits that back to the brain, telling it to either increase or decrease the transmission of hormones in the body. Without proper hormone balance, our body does not communicate well with the brain and vice versa. As a part of the normal aging process, men naturally start to lose a little bit of testosterone. This typically starts occurring around the age of 30, and we lose on average about 1 to 2% of our testosterone yearly. There are other variables that can cause testosterone loss, and specifically can compound the effect of lower testosterone in men. This can include brain or head injuries, testicular injuries, medications, chronic diseases such as diabetes or hypothyroidism. All these can play a role in accelerating the loss of testosterone for men. Symptoms of low testosterone can include anxiety and depression, low energy, fatigue, poor concentration, weight gain, loss of muscle mass, low sex drive or low libido, erectile dysfunction, poor sleep and insomnia, and can affect just a man's overall quality of life. Testosterone can be very subtle in how it's lost in the body. It can accumulate over a number of years, or it can happen rather quickly, with many men presenting with symptoms after about 6 months to a year. There's been more and more research being done over the last few years trying to figure out why we're seeing men at younger and younger ages with lower testosterone levels. There's a lot of variables at play here, but research has been finding that there's a lot of contributing factors, which could include sedentary lifestyles. We're on computers more than we used to be. We're not as active. Our diets and diet choices are poorer than they used to be. We have more access to processed foods. More hormones in our foods, of course, could be a contributing factor in causing higher estrogen levels potentially in males. Poor sleep and potentially being over-medicated are other contributing factors as well. I see personally a lot of guys come into the clinic on antidepressants. And antidepressants, while they have their place and they can help with a lot of symptoms of moodiness, depression, anxiety, I see them causing a lot of symptoms of what low testosterone would look like. So how do we evaluate and treat low testosterone? Personally, the guys that have come through who have presented with a lot of symptoms of low testosterone and even tested low for testosterone were very frustrated with the care they were getting before they came into our clinic. It seems like there is some sort of failure with primary care clinics and the healthcare system at large in addressing hormone therapy in men. There's always been a little bit of this stigma that says, hey, if you're having some hormone issues, let's chalk it up to something like fatigue or sleep apnea or just lifestyle factors that have been out of your control and you need to cope better. For years, women have been given top priority in treating hormones, and there hasn't been a lot of availability for men to have these evaluations properly performed, to get themselves tested, and to get proper treatment. And so there's been a lot of good treatment that's come out for men's hormone replacement therapy. There has been the development of pellets, patches, transdermal patches specifically, oral tablets, and injectables or intermuscular injections. We at Limitless Male prefer the injectable method of testosterone replacement. It's bioidentical, meaning it's synthetically manufactured to look like your testosterone and act like your testosterone in the body. So the body's accepting of this and it's gonna work like it should when the levels are where they should be. Men's testosterone typically tends to be between 300 nanograms per deciliter and 1,000 nanograms per deciliter. That is a very wide range. Not every man's treatment is going to fit into this nice little neat box. We need to have patient-centered care. That is, we need to follow up with what the symptoms are specifically, because men don't all present the same, and then we need to treat them based on what specific symptoms they're giving us or telling us they have. So here at Limitless Male, we strive to listen to them, to figure out what's going on. Their bodies are telling them something, and they're reiterating to us how they're feeling. And so we take that very seriously. We have a passion for doing this. The treatments we provide have been proven successful. I've seen a lot of guys come through here and get on our program, and they're so thankful because they feel so great from the results they're getting. They feel like their lives have been turned around from this. They're able to play with their kids. They're able to be better husbands to their spouses. At Limitless, that's our goal, is we want to help pick guys up. We want to be bridging that gap between what healthcare is not providing outside of our offices, bring them into us and provide that great care for them, so that moving into the future, they're able to continue to do what they want to do. They're able to have that continued lust for life, or regain that lust for life that they've lost. At Limitless Male Medical, we prefer injectable testosterone therapy, intramuscular injections via testosterone that is bioidentical to our body's natural substance. Testosterone is an organic molecule in the body. When we're discussing anabolics in the body and hormones, we're not talking about recreational steroids or anabolic steroids. We're talking about an organic substance that the body makes and produces. Injectables are tried and true. I've seen a lot of guys come in on other types of therapy, such as pellet therapy, where you insert medication into the hip and this releases into the body at certain points in time. The problem with pellet therapy is guys get so up and down with how they feel because the release and time release of this medication is very erratic. I've seen guys come in on transdermal patches or skin creams. These can get messy. They don't stick on very well. You can transfer these easy to other people if you're not careful or didn't wash your hands. We've also seen our alternative testosterone therapies like oral pills or tablets. The bioavailability of these drugs, that is the absorption and how the drugs work in the body, is just not up to par with what the injectable can provide. The injectable medication provides a superior absorption. The bioavailability of the drug and the metabolism of the drug is very efficient in the body. There's a lot of medical research to back this up, and so we prefer this as our method of choice. A part of our therapy here too at Limitless is making sure we're keeping a close eye and monitoring patients' symptoms, symptom relief, and their lab results on a regular basis. We do injectable therapy because we're able to make dosage changes very easily. We're able to increase or decrease doses as needed, depending on how patients are feeling, depending how their labs look when they come back. We typically take labs on a monthly basis, as opposed to a lot of other primary care clinics who might follow up with their patients once every 3 to 6 months or even a year's time. The problem with that is they're not able to keep therapy at a tighter set point. They're not able to keep testosterone levels within a tighter range. We are able to do that because we see patients on a weekly basis. Since we know how injectable therapy works in the body, when we provide testosterone replacement, I know that testosterone is going to be absorbed and it's going to peak about 2 to 3 days after injection. After this time, the liver is going to metabolize this medication. This is about a 7 to 10 day cycle. Other providers that maybe give injections once every 2 weeks or once a month are really doing a disservice to their patients because of the way this medication is metabolized out of the body. The problem with this is a patient's going to feel good for 2 to 3 days and they're going to start decreasing over that time. At about the 2 week mark, they're going to feel like they did when they first came in. They're going to hit those baseline symptoms. They're gonna get that fatigue back or that joint pain, that poor focus. And so they're not gonna see the great results they do when they're doing the injections on a weekly basis. We wanna get to know men on a personal level. We wanna know, what they're doing outside of the clinic, what their lifestyle is like. So that way we can help guide them and make tweaks as necessary to help them be their best in therapy. And so we need to have a really honest conversation with each other. That's why I do a one-on-one consultation, and it's a place where men can open up and tell me about their issues, family life, work, relationships, stress, everything can creep up and cause a lot of these issues and can be very concerning for men, but they don't know specifically how to relate this to their medical provider. And so I really encourage guys to sit down and just have a candid conversation with me and be upfront, tell me what's going on, let me know what I can do to properly address this. The testosterone itself will get levels up to where they need to be, but I need guys to work on things outside of the clinic to help them get to where they want to go. And we can work together basically to figure out, okay, if this isn't working, we need to go in another direction. Or if it's working great, how can we enhance that even more? If you feel that you're suffering from low testosterone symptoms, take the quiz at limitlessmale.com.